All right, we can go ahead and get started. I can begin introduction, and then once the 2 o'clock time comes around, I'll
You
be
can
able
wait
to
until 2. You can
pass
wait
it
till
on you.
2. It's still popping up. So you can wait till 2. We
Yeah.
got about 4 more minutes. I'm putting this on YouTube, so give me a second.
Also, is it possible to get the number of participants after the presentation? We usually keep track of like how many like audience members there are when we present.
Yeah, we
Yeah,
can get
we'll
that for you.
get that data to you.
Okay, thanks.
Oh, welcome everyone. I want to welcome you to the June 2025 Northeast Ohio Black Health Coalition Spring Health Equity Speaker Series. I am Dr. Zachary Williams, your host for our talk, and I want to thank our Executive Director, Ivanka Hall, Dr. Lachelle Pugh, our education and research specialist, and all of our colleagues with the Northeast Ohio Black Health Coalition for making this possible. We want to, without further ado, welcome our speaker, Natasha Takimaika, who's the William C. and Elizabeth M. Treehoft Fellow for Health Planning with the Center for Community Solutions. Her prior role as public policy and external affairs associate at Community Solutions. Natasha provides expertise on public health issues and how it relates to policy across the state of Ohio, OHIO. Her policy interests include infant and maternal health, older adults, and racism as a public health crisis. She advocates for these issues by partnering with local organizations, conducting research, and publishing reports and articles. She has professional experience in both nonprofit and governmental settings, such as serving as an intern for both former Congresswoman Marsha L. Fudge and Cleveland Department of Public Health. She also previously engaged in community outreach as an AmeriCorps volunteer at Northeast Ohio Medical University and Boys Hope Girls Hope of Northeastern Ohio. Her work at CDPH included conducting a qualitative project focusing on strategies to address domestic violence in Cleveland. And Natasha holds a Bachelor of Arts in Communication and Sociology from Hiram College and a Master of Public Health from Emory University's Rollins School of Public Health. And today, Natasha will speak on the title on the subject, the state of infant and maternal health. Where are we now, and what should we do about it? I want to welcome you, Natasha, to once again to our table and to our Spring Health Equity Season. Want to thank you for taking the time to present for us. Floor is yours, or the Zoom room is yours, better yet.
Yes. Okay. Thank you, Zachary, for having me. So let me share my screen. Okay. And let me know if you are able to see it. Okay, great. All right. So again, my name is Natasha Techimika. I will talk about what's going on in the infant and maternal health space in Ohio and what we should do about it. I am the Troy Hall Fellow in Health Planning. And if you have any questions after this presentation, or if you'd like to reach out to us for collaboration or anything like that, you can reach me by my email. I know a lot of you have probably heard about the Center for Community Solutions, but for those who haven't heard of us, our goal is to improve health, social, and economic conditions through nonpartisan research, policy analysis, communications, and advocacy. And we do that through our priority policies, our priorities actually, which is Medicaid, infant and maternal health, older adults, behavioral health, and the safety services net. So this is just the agenda for today. We will first talk about the pregnancy-related deaths in Ohio, followed by infants deaths. We will also talk about both the causes behind the data, and then we'll talk about a community health workers study that I have done about a year and a half ago, and then we'll jump into solutions. So not too long ago, the Ohio Department of Health and the Ohio Department of Children and Youth released a report about pregnancy-related deaths in Ohio. And as you can see here, they released some latest stats. So from the 127 pregnancy-associated deaths, 28% or 35 were determined as pregnancy-related. And when we talk about pregnancy-related, we are describing a death that happened due to a pregnancy complication. Non-Hispanic Black women were 1.5 times more likely to die from pregnancy-related causes compared to non-Hispanic white women. So as you can see, there's a disparity there going on. And when you look at the pregnancy-related mortality ratio, the non-Hispanic white woman rate is 25.7 deaths per 100,000 Black births. And then when you look at Black women, the rate is 38.5 deaths per 100,000 live births. And these are the leading causes of pregnancy-related deaths, according to the report. So as you can see here, infection was the leading cause of death in 2020. And I also added a note that COVID-19 was accounting for 14% of the infection category. The next leading cause is listed as other, but that includes various causes such as cardiovascular conditions, diabetes, hypertension, and so on, and hemorrhage as well. The third leading cause is mental health conditions, and then the fourth is listed as thrombotic embolisms. However, when you break down the causes of pregnancy-related deaths according to race, it's a little different. So with non-Hispanic white women, their leading causes of death are mental health conditions, which includes overdose or substance use disorder, followed by infection, cardiovascular conditions, and thrombotic embolisms. And then for Black women, the causes are infection and thrombotic embolism. However, I wanted to share this graph about maternal mental health. The Ohio Pregnancy Assessment Survey have a dashboard that pretty much tracks the health behaviors of pregnant individuals from pre-pregnancy throughout postpartum. And this is just a graph about the symptoms of postpartum depression for Ohioan adults with a live birth based on race and ethnicity in 2023. So as you can see, the leading cause, the group that has the highest percentage of postpartum depression symptoms is non-Hispanic Black individuals, followed by non-Hispanic others, non-Hispanic white as well. So you see there's a disparity going on with this issue. And this is an issue that's becoming more talked about in the policy space. So in the report, the group who actually compile all the information is called the Ohio Pregnancy Associated Mortality Review, or PAMR, and they list the factors that contributes to the pregnancy-related deaths from the data they have gotten, and they list it in 5 major categories. So and it's important to note that the majorities of these categories are kind of tied into the social determinants of health when we talk about the healthcare system. So the first factor is inadequate assessment of risk. So what they noticed is that there was a lack of screening for substance use disorder, mental health conditions like postpartum depression, intimate partner violence, and a lack of assessment of risk for sepsis. Also, there's a lack of screening for hemorrhage as well. Lack of care coordination and continuity of care refers to effective communication and organized coordination between prenatal, labor, and delivery and postpartum providers. And also both clinical care providers and non-clinical care providers, like social services. Lack of care refers to when a descendant, like when the person who passed away or a family member with them or the doctor themselves or a clinician pretty much did not really describe a warning sign or the list of warning signs that they should look out for if there's a pregnancy complication. Lack of access and financial resources is another factor. And these are actually barriers that a patient might experience. So for example, if they need some medicine, however, the medicine is expensive, that is shown as a barrier. Or another barrier is the lack of geographically accessible and timely access to needed care services like substance use, treatment facilities, or mental health care providers. And then the last factor is clinical skill and quality. This pretty much means that healthcare providers are not being appropriately trained or skilled for the situation or not exercising clinical judgment consistent with the standards of care. Okay, so now let's go into infant deaths. And I'm going to talk about infant deaths based on 2023 data, but I do want to highlight that the data that's coming from Cuyahoga County in Cleveland, they are preliminary data. So as we zoom out, you look at the stats in Ohio. The rate was 7.1 infant deaths per 1,000 live births. But however, when you hone in on more of the local data, Cuyahoga County experienced 8.8 infant deaths per 1,000 live births in 2023. And then Cleveland is even more serious at 13.6 infant deaths per 1,000 live births. When you break it down by race and ethnicity, it's the same when it comes to the geographical locations. Pretty much the closer you look into a more local area, in this case, Northeast Ohio or Cleveland, the higher the rates are. So, for example, when we look at non-Hispanic white babies, I mentioned that the Ohio rate previously was 5.7. However, when you look to Cuyahoga County, it's 5.1, and then Cleveland is 6.6 infant deaths per 1,000 lives births. And then you see a huge disparity between infant mortality rates between Black babies and as well. So they actually have higher rates. So Ohio, as I mentioned before, 13.7 infant deaths per 1,000 live births. When you look into Cuyahoga County, it's 15.9 infant deaths per 1,000 live births. And then, unfortunately, in Cleveland, it's 19.3 infant deaths per 1,000 live births, which is a lot. And these are the leading causes of infant deaths in Ohio. I do want to let you know this is not an exhaustive list. But as you can see, I highlighted prematurity as the top at the top because that is the leading cause of infant deaths across Ohio, Cuyahoga County, and Cleveland. So that is a huge issue, and pretty much there are different causes of premature births, such as stress, smoking, hypertension, infections, and so on. Even though we have all of these causes of infant-related deaths or pregnancy-related deaths, I do want to highlight that systemic racism is a cause of maternal and infant deaths. It's a major driver that propels this issue. And when you think of systemic racism, you can think of it as two different concepts. So the first one is medical bias. That means disparate care from medical professionals due to implicit biases. An example of that is actually from a qualitative study I have came across. Pretty much the study was based in California, and they interviewed clinicians who served pregnant individuals in a hospital. And this is an example, but a clinician mentioned that she don't think she should support a Black mother breastfeeding because she had that notion that Black people don't breastfeed. So that is a stereotype that she has from her own biases. Another concept of systemic racism is weathering. That was coined by Dr. Arlene Geronimus, and pretty much weathering is a phenomenon when an individual is constantly experiencing discrimination, racism, and stress. And then these factors can lead to premature aging in the body and negative health outcomes. So the negative health outcomes can be diabetes, hypertension, mental health issues, or shortened lifespans. And then an example when it comes to weathering is from a study, Holtzman and his colleagues pretty much studied the differences between Black women and white women, whether or not they smoke, and if they live in a deprived neighborhood, and how does it contribute to the risk of preterm births. So pretty much they noted that Black women living in deprived neighborhoods were at higher risk of experiencing a preterm birth compared to white women living in deprived neighborhoods. So that was something alarming, and you can think about what happens in neighborhoods. Usually there's not a lot of resources. We can also refer back to redlining as a cause of deprived neighborhoods. So it's something that we should take into consideration. And about a year and a half ago, I worked on a project about community health workers. Pretty much the purpose was to explore how community health workers, or CHWs, in Ohio work with their clients to decrease infant and maternal mortality rates, any challenges both parties have within this space, and while also interacting with medical professionals and then also solutions. So that was the purpose of the study. I have interviewed community health workers, their supervisors, a governmental official, and then also some trainers that teach community health workers. So pretty much one of the things we talked about were the challenges that the community health workers clients face in the infant and maternal health space. So a theme that came up was that they are negatively impacted by the social determinants of health. And various participants mentioned different types of social determinants of health. So for example, when it comes to housing, some of the participants mentioned that their clients might have experienced homelessness, but it doesn't necessarily mean living on the street, but couch surfing. Economic stability kind of ties into paid leave. So a community health worker talked about her client, and after she had given birth, she had to decide whether or not she should go to work sooner to pay bills or stay home and rest. Unfortunately, she decided to go to work 2 weeks after she has given birth. So that's missed opportunities to spend time with her baby. That's time missing out on just trying to recover from the whole labor and delivery process as a whole. So it affects her health. Then finally, access to care is another social determinant of health that many of the participants talked about. All right, so we're now going to talk about the state budget. So we are currently going through a state budget season, and the Senate passed their version of the state budget, and there is some things to keep note of in the infant and maternal health space. One of the things is that funding for infant vitality has been reduced. Pretty much, infant vitality refers to the programs that community-based organizations or faith-based providers organizations offer to improve maternal health outcomes. So as you can see here, the funding has been reduced for both fiscal years 2026 and 2027 from 20 million to 18 million. Help Me Grow is another line item in the budget that has been reduced in funding. And Help Me Grow comprises of a lot of programs such as early intervention, home visiting program, or Family Connects. And they have also seen it reduced in funding from roughly $63.5 million for fiscal year 2026 to $63 million for fiscal year 2026. Luckily, there were no funding changes between the House and Senate versions of the state budget when it comes to WIC. And then there was some legislative language about doulas and Medicaid reimbursement, trying to limit them to be reimbursed for to have Medicaid reimbursement for up to 6 counties, but that has been removed. So now doulas, no matter which county they are in, are able to reimburse Medicaid. So what can we do about this crisis that has been going on and it is continuing? One of the things has to do with policy. So currently, when it comes to the state budget, members of the conference committee are currently discussing the budget as to like what should be taken out, what should be kept, how can we change funding, if they need to change funding. So you can reach out to members of conference committee, but however, you need to do this by the end of this week because usually this process is very quick. It's not long. So please keep that in mind. And you can also submit letters to the governor. But it's important to take note that once the state budget goes to the governor's office, the only thing the governor can do is to veto line items. Another thing in the policy space that you can try to do is to provide support or spread awareness about House Concurrent Resolution 12 or HCR 12, which is recognizing the importance of perinatal mental health. So this was previously HCR 16 in the last General Assembly, but it didn't pretty much pass out of the Senate. So it got reintroduced about a month ago. And pretty much it's just a resolution just calling out that we need to do something about this issue with maternal mental health in our state. The Cuyahoga County Board of Health provided some recommendations on how to specifically reduce infant deaths in their report about child vitality, and I hyperlink the report as well in the slide. So the recommendations are as follows: support public health awareness and research about the causes, risk, and long-term effects of prematurity. Provide education about the warning signs of preterm labor. Provide education for birthing and pediatric hospitals about role modeling safe sleep. And I know that this is a busy table, but you will get a copy of the slides later. But PAMR, the group who reviewed the pregnancy-related deaths in the state, came up with recommendations on how to combat these deaths based on the factors they have listed. So, for example, in regards to lack of access or financial resources, a recommendation at the facility level is to understand that if patients express difficulties with following care guidelines because of financial or access issues, facilities should connect them with social services to determine barriers to accessing healthcare and provide possible solutions. And when I worked on my report with the community health workers, they have listed a lot of suggestions to combat this issue. So pretty much one of the things they have mentioned is that medical professionals need to improve relationship building skills when interacting with CHWs and patients. And some of the ways that the doctors and providers can improve relationship building skills with patients include speaking in simpler terms, do not use jargon, ask why during the conversation to find the root cause of an issue. So, for example, if a patient hasn't been going to their prenatal appointments, you have to figure out why they haven't been there. It could be a transportation issue, it could be scheduling issues, or something else. And then it's also important to involve patients as part of the healthcare team so they can know their options to certain treatments and they can make a decision on this as well. And finally, you can also collaborate with different organizations, coalitions across Ohio. So starting with First Year Cleveland, they are based in pretty much in Cleveland, but their aim is to reduce infant mortality, particularly among Black families, just making sure that Black babies are able to make it to their first birthdays. The Ohio Perinatal Mental Health Task Force is a statewide coalition, and their goal is to be one of the leading states in the country in perinatal mental health education and access to care and treatment. So they have a lot of they call it strategic area and action teams. And one of them that I'm a part of is the policy and regulation team. So, for example, with that team that I'm a part of, we just did our advocacy day about perinatal mental health last month at the State House. And then finally, there's a coalition called Time to Care Ohio Coalition. This is actually housed under Collaborate Cleveland, which is a nonprofit in the area, and they focus on paid leave for families and caregivers. And that also includes hyperlinks for each of the organizations I have mentioned if you are interested in learning more about them. And here are a list of resources you can look into to learn more about this topic. Again, I listed the reports about the data. I include my report about community health workers. The Ohio Legislative Service Commission is a good website if you want to dig more into the state budget. And then I also have some information about the federal budget that is currently going through the Senate right now on the federal level that my colleagues and I just wrote about. And yeah, and we're also listed a report that I actually have collaborated with some people from actually different organizations. So from Celebrate One, from Ohio University, and a medical student about maternal mental health solutions. And if you are interested in signing up for our newsletter, this is the QR code. And you can follow us on social media by Instagram, X, LinkedIn, or just contact us through our general email phone number. But you can also contact me by email as well. So thank you so much for allowing me to spend time with you all to talk about this important topic. And I'm open to any questions or comments.
Natasha, thank you so much for your presentation, for your expertise, and the work you're doing at the Center for Community Solutions and on this subject, your vital subject of maternal and infant health. First question I wanted to ask, then we have a few other questions as well. You mentioned the CHW report that you partnered with. You mentioned about relationship building and patients being involved as a part of the healthcare team.
Mhm.
Can you talk more about the benefits of that? It seems as if it should be self-explanatory. Patients should be the center of that, but just like in healthcare in general, they're an afterthought. So could you speak more to that and addressing that through your work with the CHW?
Yeah, so based on the conversations I had with the CHW supervisors, trainers, um, they have mentioned specifically their experiences with their clients in doctor's appointments. So they felt like the appointments were too short. Their clients weren't being heard about their conditions, and they were rushed. And probably because sometimes providers have booked up appointments for the whole day, so they can probably see a patient for like 10 minutes or a little less. So the way they explained if a patient is in the healthcare team, so it will allow them to have the autonomy to understand all the options they could do to pretty much take care of themselves. They could also ask questions if they have any concerns about certain treatments or procedures. So pretty much allowing the patient to have also a say in their treatment plan is what they have suggested.
Thank you. That's good. William asked a question about the myth that Black mothers don't breastfeed and what can be done to dispel that myth. And along with that, this question of family values. How can we change the narrative about FVs or family values? Because part of the perception is that with regard to Black women and Latinx women and other women of color, there's a different perception surrounding mothering as compared to other ethnic groups and societies. So can you speak to some of that?
So in regards to how to dispel the myth of breastfeeding in the Black community, I think it's very important to educate people. I mean, yeah, that's the only thing I can think of. Because if you don't think about it, you might just say an ignorant comment about breastfeeding. And then also, like when you educate people about it, you can provide some stats and statistics about breastfeeding. You can even find some articles or sources about Black women breastfeeding, and it'll allow them to have healthier lives. Like it reduces the chance of cancer. It also helps the baby's health. So, backing up those type of facts would help. I'm trying to understand the second question. Can you say that again?
Yeah, just kind of with that, the question of there's a sensationalization of Black families and Black behavior, and it has been for quite some time as it relates to family, rearing, nurturing, mothering, even activities like, again, breastfeeding, which are normal, regular activities. But when you associate that with the mythology, the mythologizing and stigmatization of Black families, it takes on, a negative, character. And so I was asked the question uh, relative to your answer. How do we change the narrative around family values? Because in the legislatures, there's an effort to make policy and laws around this notion of family values, but their understanding of family values are very different from family values of most people in families and neighborhoods. So they're the ones who are elected, who are representing, but they are legislating based off of and having people write laws that have this perverse view of family values, even though their stigma about us is perverse. It's more of a projection on us versus how we actually see ourselves. So what do we have to do to get those legislators to change their thinking and behavior around family values? I mean, it's again, I just want to thank you for the work that you're doing, because it's Herculean in its task, because it seems again like patients being at the center to be uh, a basic thought. It should be central, but of course, in our country and our even our state and other places, it's not not obvious, or not not as basic as we think. So, if you could just speak to that. How do we get people to realize that family values are what people share, generally and broadly?
Well, that's where advocacy comes in, like, so it's important to have that. I would suggest face-to-face meetings with legislators so they can get a concrete understanding about family values. If you want to tie family values to a bill, talk about your experience with, that's particular topic they're trying to address, so legislators are supposed to understand storytelling or understand their constituents experiences. So that is a advocacy tactic a lot of people use when talking to the legislators. um, Also, when it comes to family values, and I guess this kind of like ties in with community health work or organizations and neighborhoods. I mean, if you have a community organization that focuses on family values, or just a certain group of people as a whole, invite that legislator to that organization so they can see, okay, these are the day-to-day operations, and this is how this organization is helping, for example, a family unit or residents in their community. So just trying to talk to legislators face to face, or trying to have them come to your community. That's important. You can also do this by writing op-eds too if you don't feel comfortable doing face to face. But those are my suggestions.
Great suggestions. I just wanted to also say that Dion says a great presentation. Her questions were answered. I have one other question. It's controversial, so you can pass on it. It shouldn't be controversial, but family values are not necessarily central to everybody. But think about this. You mentioned weathering, and we
Mm-hmm.
had Arlie Hochschild to speak for us. I think a few years ago. Also, along with weathering is mothering. Think about this. Teachers have labor unions. People who teach. Firefighters have labor unions, right? Who fight fire. Police, we know all the controversies around police and labor unions. What about the idea of mothers forming labor unions? Because mothering is, a labor of love, act of love. I remember how soap operas got started, for instance. And soap opera corporations, what's the corporation company in Cincinnati? Can't think of its name now. Procter and Gamble. They appeal to white suburban mothers in order who are at home trying all their products and stuff, and house goods, because they were able to market those to them as a part of commercials, right?
Mm-hmm.
So the question is, why not mothers forming labor unions as an act of labor And I mean, it may seem like a fantastical idea, but if you could just, and that may be beyond the conversation, but based on what you're sharing and what you're talking about, could that even be? Ideas are is what we think of. So could that actually happen? I mean, we didn't think the internet could happen, and here we are, artificial intelligence. Could we have mothers as labor unions? What do you think about that?
Well, that's a great question. And I think that it's possible, but you also have to figure out who are interested, how many people you can gather. I mean, there are plenty of organizations out there that have formed nonprofits based on an idea. I think as long as you have a group of people that pretty much believe in the same thing, they have the same cause, and are able to, I guess you could say, fight the fight. Why not? I mean, the U.S. is supposed to be a land of opportunity, right? So, there could be opportunity.
Thank you for indulging my question. And so who knows? I mean, maybe as we speak about it, maybe who knows? We'll have labor unions because all politics is local everywhere else, and that may change the face of politics everywhere. So I mean,
Mm-hmm.
someone asked, do we know if Ohio's Medicaid expansion population loses coverage, due in part to the trigger language in the state budget? And with that, do we know the impact that the loss of coverage will have on racial disparities, especially because of how common Medicaid is in covering pregnancy costs?
Okay. So, I'm going to answer the question the best I can. Um, we have a colleague here that's a Medicaid expert. So if I don't answer it correctly, please reach out to me. I can connect you to her. But if the FMAP language is in effect from the House, unfortunately, we're going to lose a lot of people from Medicaid, over 700,000 people in Ohio. Um, However, it gets kind of complicated because you they are also looking at the federal budget. So with the federal budget, there are um, risks to Medicaid cuts. So pretty much, and this is where you have to like actually get into the nuances between the federal budget and the state budget. But pretty much, um, if the state budget, well, if the federal budget cut Medicaid, and there still could be a chance that Ohio can like cut Medicaid and for Ohioans. But if you need a deeper, more analytical question, please reach out to me personally. I can connect you to someone about that.
Hi. So
Ivanka, I can't hear you.
thank you. You did a wonderful job in Northeast Ohio, particularly in Cleveland. I don't think people understand like the nuances around infant and maternal mortality. And here we have so many other factors, environmental factors that play into this also. We have poor air quality. We have, particularly around particulate matter. We have a lot of lead. We have an educational system that has literally failed, our children. So we have, the jobs, which we used to call them what were they during COVID? Essential workers, which are us, and so we see a lot of pregnant women that are working um, a number of jobs that expose them to a lot of other things during their delivery time. For me, I know that the governor is a lame duck, so he could do two things. As a lame duck, he could actually go along with the get along, or he could be very transformational and say, I'm not going to go along with this body. And so I mean, you never know with him. There was some of his responses to COVID were, some of them wishing when they were calling for her firing. and then letting them kind of like have their way with the rest of, our COVID response. So, for us here in Cleveland, I think, that we have to make sure that not only are we um, using our white counterparts to push for change in the House and the Senate, because I think that letters coming from Black folks ain't gonna help, ain't gonna change us. For them, they look at us as being the main users of Medicaid. And I think that, one of the, or the main in children, right? And not looking at the impact on white women, also. Um, and so I think that this is when the finding out who your allies are is going to be extremely important, because I think those alliances are going to be the things that can help change some to the local governments in the state and in Cleveland in particular. And so I think that, those things are things that we also have to look at when we're talking about policy, like strong alliances with people that can actually help change the thought pattern for our legislators. And so for me, that's just important. And so what do you think about these creating these alliances?
No, I agree with you. It's very important. And they can help provide a different perspective that can kind of like help sway or solve the issue, or how to talk to legislators. You have mentioned about you mentioned something about Medicaid, and the legislators don't understand that white women have Medicaid. On our website, we have the Medicaid fact sheets, pretty much describing like per county how many people are on Medicaid, and other demographics in regards to that. So this is very like a recent thing we have released like a couple of months ago. So you can use those fact sheets as examples, because some of the legislators, their constituents are mainly, Caucasian Americans. So you can use that as a good resource so they can have like of a more, I guess you could say, view of what's going on in their county when it comes to Medicaid.
And kind of along with that, Natasha, can churches do more, particularly Black churches, to aid and assist in the battle against maternal and infant mortality issues? I mean, what more can churches do, in your opinion?
Um, so I think the only thing I could think of is collaboration. Just try to collaborate with other organizations, or maybe like providers in their community. I know that personally, for example, the church that I go to, a couple of years ago, they had invited some um, Black maternal health professionals, psychologists, to talk about maternal health, because May was Maternal Health Month. So I think it's just, you know, the churches can reach out to the providers, or reach out to other like-minded organizations to address um, health issues in the community.
I want to keep you in the loop because we're for our conference. We're having one of the speakers is going to be Professor Dr. Wyland Wilson, who's a professor at Duke Divinity School, and she does a lot of work with womenist bioethics, and she's convened forums around health issues, as relates to Black women and with Black churches. And so, hopefully, at some point, if not for this August 8th conference, some virtual conference on environmental justice and social terms of health, we want to have a separate forum, and so we would like to to have you be a part of that if you have time, if you have time and if you have space and you're willing, you're able to be able to participate. Just to convene such a broader conversation. So please keep us in mind for that.
Okay, thank you.
Thank you. Are there any other questions for Natasha or comments before we wrap up for today? And see. Seeing none, Natasha, just want to thank you so much. I mean, you're an incredible resource and thought leader and policy expert, and appreciate the work that you do in your partnership with Center for Community Solutions, and how you've been a partner with us. Every time we call on you, you're available and you're willing. And so we consider you a valuable partner. And so you're an asset, not just to Center for Community Solutions, but to Cleveland and Northeast Ohio and to everyone in our nation. So just want to thank you again for presenting for us today and sharing your expertise and insights with us. Thank you.
Yes, thank you for having me.
All right. And I guess that's all for us for today. We want to also welcome you to the July 28th presentation from Dr. Annabelle Suimo, who is a reproductive health care specialist, physician, student, and scholar in Great Britain, who will be presenting on decolonizing medicine and healthcare. And she'll be internationally known expert. She'll be presenting for us on July 28th, and we will share more information about that. If you want more information, please be sure to contact us. Visit our website, Northeast Ohio Black Health Coalition, and our Facebook page. And check out our YouTube page as well, where we will feature a number of our talks, such as the talk that you hear today. I want to thank everyone who attended today.
And
See a lot
Dr.
of
Williams,
partners, friends, and colleagues.
don't forget about the reimagining community conversations. So we have the reimagining community
Yes.
conversations that'll come up. It's our partnership with us, Ohio State University, the National Oceanic and Atmospheric Association. Basically, we're talking about climate and coastal resilience. It's going to be held at the MLK Library. So the new remodeled MLK Library on June the 28th from 11 to, I want to say it's 11 to 1, 11 to 2. We're going to provide lunch for everyone that's there. Actually, also we'll have some air purifiers because at this current state in Cleveland, we definitely need them. We have given out more than 800 so far. And so hopefully we can, make that a few thousand by the time our summer ends in our 9 counties. But we have it here in Cuyahoga County. On the 26th, it's in Lake County. We have them all summer long in the 9 county, our 9 county focus area right now. But we hope to see everyone on June the 28th from 11 to 1 at the MLK Library for our Reimagining Communities conversation, which is talking about coastal climate and coastal resilience here in Northeast Ohio.
Thank you so much, Ivanka. I want to thank everyone. Thank you for allowing us space to be able to convene this table, and thank all of our partners and everyone who's in attendance. And stay tuned for future events and updates, and continue to support the work of Northeast Ohio Black Health Coalition. And we look forward to working and partnering with all of you to continue the great work that you and all of us are working to collaborate to do everywhere. So thank you all so much for taking the time to be a part of our presentation. And thank you again, Natasha. Thank you, Ivanka. Thank you, staff and everyone with the Northeast Ohio Black Health Coalition. And hope you all have a great rest of your day and great rest of your week. Take care.
Have a good one.
Have a good one. Take care.